Every 7 minutes, heart disease and stroke take the life of someone in Canada, and 90% of Canadians have at least one risk factor. February is Heart and Stroke Month, so Global National's health specialist Dr. Zentner is here to talk about it. Obviously, men and women both have risk factors, but what is it about women that we should be more concerned about?
You know, I think men and women are equally at risk for cardiovascular disease. We're equally at risk in terms of risk factors for heart attack and stroke. When it comes to stroke, however, 60% of deaths happen in women, so we have a higher death rate from stroke. We have higher risk factors overall for cardiovascular disease. So, for example, diabetes in women is more poorly controlled than in men. Hypertension in women is more prevalent than in men, and we live longer. So our cardiovascular risk spans a longer age span.
And today the Americans released some guidelines which could obviously apply to Canada. What are those guidelines?
So the American Heart Association just last week released stroke guidelines specifically for women. Women who are taking birth control pills should be screened for high blood pressure. Birth control increases the risk of stroke, albeit a small one, but high blood pressure accompanied with that increases the risk. Migraine sufferers or people with migraines, specifically with auras, have a slight increased risk for stroke, so they should absolutely stop smoking, as quite frankly should everyone. And then there's a condition called atrial fibrillation, which is a rhythm disturbance, more prevalent in women over the age of 75. In fact, 10% of Canadian women suffer of it over the age of 80, and that also increases stroke risk. And so women should be screened for it over the age of 75. The other two sort of guidelines that have been released is women with high blood pressure of moderate to moderately severe range should be treated during pregnancy. And then if you are getting pregnant or thinking of getting pregnant and you do have high blood pressure going into your pregnancy, there's a recommendation now by the American Heart Association for low-dose aspirin and for calcium supplementation to prevent preeclampsia. Now, low-dose aspirin is still off the menu for primary prevention in women for cardiovascular disease and stroke.
All right, good tips to have. Thanks very much, Dr. Allen.
Thank you.